This is a continuation of chapter 9 from Womble, the anxiety chapter. I believe I left off slides 7, 8, and 9. Slide 7 talks of phobias, and the specific phobias are excessive, persistent fear of an object or situation, and they usually have anxiety on contact. Those are listed in your textbook on page 125. There are 15 listed there, and you might find more in other references. Social phobias are also called social anxiety disorders. That can be an excessive fear of a social situation in which embarrassment is possible, or discomfort being watched, or at risk of being judged by others, or anticipatory anxiety. And I would think of that as a little more of generalized anxiety or free-floating anxiety. They just are afraid of what's to come. On slide 8 is obsessive-compulsive disorder, and that's illustrated in our movie As Good as It Gets. Many good nurses and teachers are obsessive and compulsive, and we're very thorough, and we're very intent on getting certain things done, but we hope it's controlled so that we don't need therapy and medication for it, and it can be used to our advantage and your advantage. Obsession is a recurrent, persistent, unwanted thought or image causing intense anxiety, and the compulsion is the behavior, the repetitive behavior engaged in to reduce this high level of anxiety. And again, we see that in Jack Nicholson's character in As Good as It Gets. On number 9, we've talked about post-traumatic stress disorder before, I believe, in growth and development. Its acronym is PTSD. That's illustrated in the movie Born on the 4th of July. Response to a situation involving an actual death or threat of injury is usually the trigger. Intense feeling or fear following an event causes the problem, and they have mental reruns of the event, many times in nightmares, but sometimes every time they open their eyes. Emotional numbness, they feel like they're stuck emotionally, and then they're not expressing emotions as they should in other parts of their lives. They have an avoidance of people and places associated with an event, and they probably have insomnia, inability to concentrate or focus, and impaired social or work functioning. Now I'm going to look just briefly at the new ATI, the 2014 edition. It's edition 9.0 PN Mental Health Nursing, and you have only an online review book of that, I believe. This is on page 88, the anxiety chapter. I'm only going to go over the overview, just a few points here. In your first bullet, it says normal anxiety is a healthy response. It's something we're expected to have and we're expected to be able to control. In the second bullet, it talks about the levels of anxiety that you might have, 3 levels. Mild, which would include restlessness, increased motivation, and sometimes irritability. Moderate, which would include agitation, muscle tightness. Severe is a disability to function with ritualistic behavior and unresponsiveness. And then we go on to panic, which is a distorted perception, loss of rational thoughts, and immobility, absolutely not able to do anything. Then in the third bullet here, they speak of DSM-5. So this is nice, and this is interesting that on your PN NCLEX for the mental health, you will be talking about the DSM-5, and I do have a copy of it in my office. You can check it out overnight if you need to. Separation anxiety disorder is the first one that they list, and we've discussed that a lot in growth and development about in our children's chapter also. And I don't see that happening in adults. I don't believe separation anxiety disorder would ever be included with the adult population. Then there's panic disorder, which, as I said, in reference to Womble's points, that you would expect to see that in the emergency room, and it's usually recurrent. Then there's the phobias that tend to be very interesting when they develop a fear of a specific object or situation. And then general anxiety disorder, which they do list with the acronym GAD. The client exhibits uncontrollable excessive worry for more than 3 months. So that is an important point, and I believe we addressed that in the essential questions. Other disorders not specifically identified by the DSM-5 as anxiety disorders but that have similar effects include the following: the obsessive-compulsive related disorders, and that's explained in depth here. The client has intrusive thoughts of unrealistic obsessions and tries to control these with compulsive behaviors, and they give examples of like washing your hands over and over again. Then there's hoarding behaviors that they have listed under anxiety disorder, which was interesting to me because, of course, that's come to light with these, reality TV shows. Trauma and stressor-related disorders include acute stress disorder, which is a response to a traumatic event, and it may cause numbness, detachment, amnesia about the event at least 3 days, but not for more than 1 month following the event. And in our country, we usually think of those involved in the 9/11 attacks, but in other countries where they went through genocide, or what's going on now in Syria and Iraq with children being tortured, you can imagine, and beheaded, and other children having the possibility of seeing this, you can imagine the stress disorders that would ensue. And then the last one that I'll discuss here, post-traumatic stress disorder, PTSD, which we see illustrated by Tom Cruise in the movie Born on the 4th of July, and I believe it came to light mostly in the Vietnam War. And exposure to a traumatic event causes intense fear, horror, flashbacks, feelings of detachment and foreboding, restricted affect, and impairment for longer than 1 month. So here we see a period of time put on that, and we know that in the United States, the Veterans Association has specialized in treating those folks with PTSD and helping them to become functional members of society again.